Hi, my name is Isal Perera. I'm a student nurse at UC Manitoba. Today we're going to be demonstrating blood transfusion administration. So we have our patient ATRIQUE Jerry, MRN 654456, FIN 261824375, and we have an order here for transfusing 1 unit of packed blood cells over 2 hours, and for hemoglobin of 68. So we're giving 20 milligrams of Lasix after the transfusion. So we're going to make sure to give that after. And so general orders could be given as CBC to be drawn post 4 hours and transfusion. We read the physician's order, and so we see the reason why the doctor's ordered for the packed blood cells to be given is because we see the hemoglobin, the patient hemoglobin as per labs showed that it was 68, so that's low. So that makes sense why the doctor has ordered for the packed blood cells to be given to raise up the hemoglobin levels. Okay, so we read the physician's order, everything was fine there, and we're just moving forward and we see the consent form. So ATRIQUE Jerry, FIN number 261824375, so it's the right patient, and we see here that the patient and the physician has signed it, and everything was fine, and then time and date is on there as well. So the written consent has been given. So next we're just going to be calling our buddy nurse over to do our checks. So I'm going to be reading from the record of transfusion. My buddy nurse will be looking at the demographic. So we have our patient here, ATRIQUE Jerry, or ATRIQUE, ATRIQUE. This is the last name, and then Jerry, first name, JERRY. Okay, and then the FIN number MB 261824375, and our buddy nurse would confirm that. So now that was our first check. Now our second check, we're going to go, I'm going to be looking at the record of transfusion. My buddy nurse will be looking at the blood tag here. So last name, ATRIQUE, ATRIQUE, and that was last name, and then first name, Jerry, JERRY, and FIN number MB 261824375. And we see that the patient blood group is AB positive and component is AB positive as well. So it's our duty as nurses to make sure it confirm that this is compatible, and we confirm that AB positive and AB positive are both compatible. So that's good. And we're looking at the donation number here. It's C051008900445Y in the box. And now we're just guys, to get our second buddy nurse to confirm that with the blood tag, and they confirmed that it's correct. So next what we're going to do is I'm going to be looking at the blood tag, and my buddy nurse will be looking at the blood bag. So I'm gonna be so next I'm gonna read and see that this is red blood cells. So we have here as given as the red blood cells. Okay, so yeah, so it's red blood cells given there, it's red blood cells here, and so we know that it's the correct component. And then also we look at the compatibility, so it's AB positive, blood group is AB positive, patient blood group is AB positive, and we're looking at here that the expiry date or the donation number here, so C051008900445Y in the box. And our buddy nurse confirms that this is the right, and everything is fine. And now I'm just going to inspect the bag and seeing that the expiry date, it says it expires in 3 days from the specimen collection. This is what it would say in lab, but in real life it would give us the expiry date. As expiry date we're going to here is today plus 1 month from now. So that's the expiry date there. And also I'm going to be looking at the bag here and seeing there's no abnormalities, and since there's no streaks in the bag, there's no streaks, or there's also no discoloration of the blood, no clotting. Okay, and just taking notes here. Okay, all right. So I'm just gonna wash my hands and making sure that so we confirmed that it is red blood cells, is given as red blood cells. Okay, so that's the type of blood. Okay, and now we're just going to get our supplies ready. So we're just gonna get our normal saline, we're gonna grab gloves, alcohol swabs, and we're gonna grab our tubing set here. Okay, so and we're just gonna wash our hands. We're gonna head to the bedside. So doing a quick safety check before we enter in. Call on nearby, that's what there's no stress. Everything's fine. So we're gonna enter yourselves. Hi, my name is Isal Perera. I'm a student nurse at UC Manitoba. Is it okay if I just check your armband to see if it's the right patient? So we're checking the armband here. So I'm gonna be looking at the wristband. You wash your hands before you touch the patient. I'm gonna be looking at the wristband, and my buddy nurse will be looking at the blood tag here. So ATRIQUE, that's last name, and Jerry, first name, JERRY. Okay, and FIN number 261824375. Our buddy nurse confirms that. I'm gonna ask the patient, can I get you to verbally state your first name and last name? And verbally spell out your first name and last name. So the patient has spelled it out. Okay. Can I get you to state your date of birth? Okay, the patient said date of birth. Okay, everything matches. We got the right patient. So Mr. Jerry, the reason you're getting this packed red blood cells is because your hemoglobin was 68, as the lab shows, and that's low. So that's why the doctor's ordered for you to be given these packed red blood cells to be given to increase your hemoglobin levels. So you might experience some side effects such as hives, maybe rash, or like kind of fever. So if you are experiencing any of these, just fever and chills, if you're experiencing this, just let me know with the call bell. We'll do it to assess you. And I'm going to be and I'm going to make sure that I'm going to stay with the patient for the first 15 minutes to basically assess for any reaction that occurs. I'm going to note that there's an emergency line present there, so just in case if there's a reaction that occurs, we'd stop the infusion and put the emergency line on. And then I'm going to be assessing just also the patient's assessments. So I'm going to assess for side effects, right? Just in case when I'm staying with the patient for 15 minutes, and I'll also be taking the vital signs after that 15 minutes as well. Okay. So next, I'm going to tell the patient, so I'm going to be taking the vital signs right now, make sure that it's stable, and then I'm going to take it 15 minutes. I'm going to take the vital signs again after 15 minutes after the blood has entered the patient's IV site, making sure that it's stable, and then I'm going to take it every hour during the transfusion, and then after the transfusion and 1 hour post-transfusion, making sure everything is stable and in the bed, and then we educate the patient. So doing this, do you still consent to the procedure? The patient has given consent to me, so we can go forward and do it. So we're just going to wash our hands, and we're just going to prime the line here.
So I've already acknowledged there's going to be an emergency.
I'm going to make sure to clamp this up here. Make sure all the clamps are on. And then clamp this on as well. Okay, so I'm just going to now spike the mini bag here. Okay. Maintaining sterility. Okay. So I'm just going to unclamp it here. And that's what I want to run, making sure this is clamped to the top here. Okay, and then clamp this. Loosen this a bit. Okay, so it's dripping. And we're getting rid of any air bubbles that are present. There's no air bubbles present in the line. So we're just going to clamp it. And we're going to prime this chamber here. So the reason we want to prime this chamber, as I was saying, is just because when the blood goes through, we want it to be, the filter to be filled with normal saline, just so that the red blood cells don't go through without it. If it does, then it would destroy the red blood cells. Okay, so we know that it's primed there, so it's all good. And now we're just going to put on our clean gloves. Wash your hands, put on our clean gloves, and put on the blood bag. So the So we're going to spike the red blood bag here, the blood bag here. We're going to make sure the normal saline is clamped. And then we're going to clamp that as well, and we're going to spike it using strap down. Okay, so we spiked it out. Okay. So now we're just going to, so we made sure the normal sand is clamped. Let's clamp there, and I'm just going to unclamp the blood here. And we're going to let the blood prime.
Today's looks good. So now nurse will have a second nurse to do an independent check. So the second nurse check and it's confirmed correctly. So now what we do is that this my medication was raised. Gonna draw it back.
So we're just going to make sure that the blood primes all the way down the tubing until the end of the tubing set, then we would clamp it. Okay. Okay, just gonna make sure that it gets to the end of the tubing here. Push on the lip.
You have 10 minutes, bro. Well, 5 minutes, yeah.
So the blood has got to the end of the tubing, so we're now just gonna clamp this up. Okay, and we're gonna so we're just gonna go and set them up here. So we're gonna go to primary. Gonna change mode. Gonna label the line. Select. Go to red blood cells. Right here. Select that, and then we labeled it. And we're gonna set the rate. As ordered was 50 cc. So we're gonna set it for 50 cc at the start, just because for the first 15 minutes we're gonna be monitoring the patients for any kind of changes and reactions that occur from blood, and that could occur. And we're gonna set the volume to 358. There's the bag here. It says 358, 358. Okay. So now we're just gonna open this up here. Okay. Open this up. Okay, closed it. Okay, so now we know that it's on. And now we're just going to swab the site here with our alcohol swab, which we have here. So I'm just going to swab this for 30 seconds. Let it dry for 15. Swab for 30, let it dry for 15. And then we're going to have our syringe we have here, which we have here. And just in case if we did contaminate, we would get another alcohol swab, and then we would swab it for 30 seconds and let it dry 15, but we already did, it didn't contaminate. Okay. Now we're just going to prime this. Make sure there's no air bubbles. Inject that in. And we're going to prime it. And we checked the patient's IV site before, there's no abnormalities there. So are you feeling any pain when you prime? When I flush it? No? Okay, good. Okay, and now we're just going to attach on the here, typically. Okay, so now we attach it on, and now we're just going to make sure to start the line here. So make sure all the clamps are open. Everything, all the clamps are open. Okay, so we're going to confirm primary. And we're going to start it. And so we're going to make sure that the blood is open, no insulin is clamped, and we're checking for the 3 drops here. There's 3 drops right there. They're checked for the drops, and we're make sure all the lines are open, everything's fine, and the patient has an emergency line just in case. And so, as I said before, I'm going to wait for the first 15 minutes for the patient to see if any changes in their vital signs. Their vital signs are fine, and now I'm just going to go and change the rate now to the correct rate, which is now 197 mL an hour. After I waited for vital signs, and after I waited, and I'm going to verbalize that I've already taken the patient's baseline vital signs before, and they were good. And I've stated the vital sign protocol, which was that I would take the vital signs after 15 minutes after the patient's the blood has entered the patient's IV, and then take it after every hour during the transfusion, and then take it after the transfusion, and then take the vital signs again after 1 hour post transfusion. Okay, so we've done that. Now we're just going to make sure. So if you are experiencing any side effects we discussed earlier, just let me know with the call book. I'll be there to assess you. And I'm going to make sure all the clamps are open and everything is fine, everything's running, patient's good running. And then I'm going to do my exit safety check. and then there's no cob on your body. That's a sufficient piece of non-stress. Everything looks fine. I'm just going to take my gloves off, wash my hands, and I've noted the 3 drops are all there. And I'm going to document on my cumulative blood product sheet that I've given the, so I'm going to document on this sheet here. Cumulative blood product sheet right here, and I'm going to document with the second nurse check and the vital signs as well. Okay, so 2 nurse check as well, and then and that concludes the end of my demo.